Welcome to DC to Be Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Brian Morrison. He's the Director of Chiropractic Services within the Center for Integrative Medicine at the University of Maryland School of Medicine. He also teaches chiropractic principles to fourth-year medical students and owns Morrison Chiropractic. Dr. Morrison, thanks so much for being here.
Oh, you're welcome. Good to see you, Noah.
Yeah, likewise. So I wanted to start talking about the Center for Integrative Medicine. What's kind of the origin story behind your involvement with the center?
The center has been with the University of Maryland for well over 20 years. It's one of the first centers. And Brian Berman is a medical doctor who was the director there, and he was able to get some grant money together and some supporters. So they started an integrative medicine center, which was placed on the second floor of a satellite hospital for the University of Maryland, sort of in suburban Baltimore area. And so they had a medical doctor who did integrative medicine. They had acupuncture were the two things that was Dr. Berman's real interest was acupuncture. And one of the directors of the clinic came to my office for some care, and she said, "Gee, we really could probably use what you do down here. Would you be interested in coming down?" I said, "Sure, that would be great." And I went down, and so their offer was, "Why don't you go ahead and rent a small space from us, however many days a week you want to, and we'll refer patients into you." And I thought, well, there's a foot in the door. So I took it, and had been down there for several years. And then the clinic changed its whole complexion, and I stopped seeing patients down there. But in the meantime, they'd asked me to start teaching. And so my involvement really became more about teaching. They had an elective, probably one of the first electives for fourth-year med students, that they wanted to expose them to manual medicine, chiropractic, and that sort of thing. So it started out as about a 1 or 2 hour program. We had 4 students in it. It was not a big deal. Time goes by. They bring in a new educational coordinator who really upped the educational component. Now the class, there's 2 sections of it, and it's an elective, but the elective is full house every section. The students love it. And their fourth years, they're family medicine, they're internal medicine. We had PMR docs, orthopedic surgeon residents coming through. And so as I was doing that, they decided they want to expand the clinical side. And so that's what they did. They brought in a new clinical director. They fully staffed it. We had 2 chiropractors there, 2 acupuncturists, massage therapy, a bunch of other things. And we developed a chronic pain pathway that involved all of the players in integrative medicine, including a cognitive behavioral therapy psychologist. And we started working more closely with the physical medicine rehabilitation department in the hospital. And so things went along pretty well, but it was still funded by an independent party, and that funding ended last year. So right now the clinic is in a hiatus.
Okay, yeah. So that's been quite a roller coaster you've been on there.
Yeah, interesting.
Yeah. Well, and thank you for the work that you've done, kind of creating this. Do you feel like the kind of the curriculum and the protocol and everything that you've put into place is easily replicated at other centers? Is this kind of like a pilot that could be then transferred to other medical schools, or is it pretty specific to your location?
No, it's very generalized, actually. We were fortunate enough to have a preventive medicine resident with us who helped us write the program. So she really wrote it from a community health aspect and very encompassing aspect. So there is basically a tree to follow, an algorithm to follow, concluding the triage portion of it. And I also teach this. There's a Maryland University of Integrative Health, not to be confused with the University of Maryland Center for Integrative Medicine. Try saying that 10 times real fast. And they have a doctoral program in acupuncture, and I expose them to this program at that institution as well through teaching. So I think this could be replicated. I think a lot of people are also working on this project and this wheel. We had people come in from different health provider organizations, like up in Pennsylvania, some from California, came out to look at our model. And the big thing was everybody that was trying to make a model is, how do we make it profitable? How do we make it pay for itself? And that is the unknown right now in integrative medicine centers. They do not generate profit. I think Vanderbilt is probably the only one that does.
Yeah, that's extremely relevant for, us as students, because I know a lot of students want to get involved in integrative medicine. They want to, I've talked to a lot of people who are doing the University of Pittsburgh program and primary spine care.
Fantastic program.
Yeah, fantastic program that they seem to be kind of like pushing that integrative model, the multidisciplinary collaborative care model forward. But like you said, the profitability. So let's, kind of look at Morrison Chiropractic and what you do at your own chiropractic clinic. How does what you do there differ from kind of the integrative care environment, and how is it similar?
Well, we've actually evolved quite a bit because when the center was closed, there was two medical doctors who had nowhere to go, and I had some extra space in my office, so we've actually set them up doing integrative care in my office. So I have a DO, I have an MD. They've brought in a cognitive behavioral therapist. We have a massage therapist, acupuncture, and a few other integrative disciplines there. So they're a good adjunct to the office. They're completely separate from us from a economic standpoint or business standpoint, but they're tenants, and we have a very open door policy. And I've worked with these docs for a long time. We know what each other is about. So my practice functions as a chiropractic practice. Patients come in, it's neck pain, back pain, headaches, right? More chronic pain maybe than a lot of people see. I've taken the pain science model into my office wholeheartedly. So we see a lot of patients that have chronic pain. We use Carl Amendolia's stenosis boot camp model in my practice. We use Dr. McGill's model for spinal stabilization. I'm sure you're familiar with all these wonderful things. McKenzie, mechanical diagnosis and therapy. And I'm really getting a lot out of a book called World of Hurt. So do you guys reading this one?
I just ordered that on Amazon based on a recommendation.
This really helps you with an integrated model.
Yeah.
Okay, so good, happy reading. But that's a great book. So I'm starting to develop some of our practice side based on what they cover in World of Hurt. So we have a lot of back and forth. If I have Medicare patients that I can't prescribe x-rays for, then they don't get paid for, that the integrated medicine doctors, if we need medication, they're there for us. If we need nutritional supplements, an anti-inflammatory diet, we have people with systemic issues, gut biome stuff, they all go over to see integrated medicine, and they usually send people over for a course of whatever type of chiropractic we have. If they want some dry needling, if they want just rehab, if they want manipulation, that's we're there to provide.
This is great because I feel like this clarifies a lot of questions that students have who want to kind of open this integrative center and aren't quite sure what it looks like or what the patient flow is or how that collaboration between, the doctor and the chiropractor and the behavioral health specialist, how all that fits together. And I would assume that this is a really profitable model that you've developed here and is actually working better than perhaps the straight chiropractic clinic. Is that true?
Well, I'm not a straight chiropractor, so I'm not sure, but I know what you mean. But a completely chiropractic clinic, it has its ups and downs. There's things you have to figure out about it. We've got it to a pretty good point. The integrative medicine centers, people have only been with me for a year. I can't speak to their profitability, but I know they're doing better than they did at the university. So that's what they're telling me. I think it can be completely done. I think the problem we find in integrative medicine, especially integrative pain care, like the primary spine care model that you're talking about at Pittsburgh, is that healthcare is still set up to pay us to do, not to think. So a lot of the pain management stuff that we do, a lot of the interviewing that we do with patients is not something you're going to get paid for. So you have to kind of figure it out, how you're going to drop it in there. What does it look like to you? So I drop in a lot of pain education while I'm doing manual therapy or while I'm doing movement therapy or exercises. So we do get that component to offset our time. But we are paid still to check a CPT box, not to actually do something or get a good outcome at this point.
Yeah, I mean, it feels like this whole third-party system that's been developed in healthcare of, somebody else who has maybe no idea of care in general, deciding how much people get paid and all that is a huge problem. Are you primarily an insurance-based practice or a cash practice or?
It's insurance-based.
Okay.
There's barriers to care to people if you don't take insurance. And being in practice 30 years, a lot of my patients have grown old with me. So I have a lot of Medicare patients. And as you know, Medicare is a pretty bad payer as far as it goes. And there's a lot of hoops to jump through and so forth. But if I dropped out of Medicare, I would shut these patients out of care. And these patients have been extremely loyal to me for many, many years, and I'm not willing to do that to them.
Yeah, I think that's really important. In your mind, seeing kind of the landscape and seeing all the models that are out there, what do you feel like is the most important thing a student can do to create more of these opportunities, more opportunities to work in an integrative care center, more opportunities to, be a part of the broader medical pain management landscape?
Well, they need to read a lot. There's a lot of great material out there. They need to take advantage of podcasts. Chiropractic Science podcast with Dean Smith is just a great place to go listen. Join the Forward Thinking Chiropractic Alliance. Get more national oriented in your scope of who you talk to. I think that the biggest hole in chiropractic education and professional development is lack of residency programs. I think any student who wants to get into an integrative setting where he can be toe to toe, eye to eye with his medical colleagues really needs to at least do a fellowship or a residency, and that's just not there. And that was one of my goals going into the Maryland program, was to develop a residency, but that didn't get a lot of traction as I brought it up to the community at the time.
Yeah, I mean, thankfully, the VA is doing a great job with their residency program. They seem to be the premier option at this point. So, really grateful that they're continuing to get funding and continuing to grow and provide that level of care. So, if there were, 5 things that chiropractors who wanted to get an integrative care model needed to read or needed to expose themselves to, what would be your kind of short list of recommendations?
Well, I really think you'd need to read anything Dr. Liebenson has put out, because he's a really fantastic integrator. He also cuts through a lot of the window dressing on a lot of technique and a lot of procedures and gets right to the key points of it, and is able to integrate both a biopsychosocial component into his manual therapy component, into his rehab exercise component, into his coaching component. I think Craig is really the most incredible integrator that I've had the experience of learning from. So I would read Rehabilitation of the Spine for certain. McGill's work is cover to cover for me. I think, as I get through World of Hurt, I think it really makes a fantastic integrative model. And then whatever Lorimer Mosley writes is probably a really good idea. And Adrian Lau doesn't get a lot of traction in our profession, but he's the therapeutic neuroscience educator who was with Mosley and Butler's group in Australia, but he's come to America, and he's in Chicago or in Illinois area now. And he has I think it's the Institute for Spinal Pain or something like that, International Spine and Pain Institute, and he's got some great stuff. The book Therapeutic Neuroscience Education is one of the best metaphor developers for educating patients about pain and de-threatening pain, de-threatening movement. He comes from a manual therapy background. So I think those would be some good places to get started, and there's a ton more.
Yeah, I mean, there's always more to learn, it seems
All
like.
Murphy's books,
Yeah, the Murphy's books have been pivotal for me, for sure. I love everything that he's doing. So, if students want to learn more about what you do in your practice, learn more about, this integrative care model that you've really been successful at kind of pioneering at the University of Maryland and in your own clinic, what's the best way for them to learn more about this practice?
They could just reach out to me through my office email, which is brian.morrisonchiro@gmail.com. They could go to my website and send me a email through our website, morrisonchiropractic.com. Those are 2 really good places to get a hold of me.
Perfect. Well, thank you so much for coming on the show, sharing your knowledge, sharing your experience, helping to move the profession forward and to help chiropractic students really, be successful and recognize create the practice of their dreams. I really appreciate that.
Thanks for having me. I have a vested interest in this because my son just started Logan in January. So, I'm bugging him.
Oh, yeah. Good.
Well, good luck to you, Noah. This is a great program. You're doing a great thing here.
Oh, well, thank you. Yeah, I love doing it. I love having great guests like you and just seeing the whole landscape of chiropractic. There's, as Bobby maybe says, it's kind of like a choose your own adventure. There's so many different directions you can go. And so, yeah, I have interviewed him, and it was a great interview. We talked about the biopsychosocial aspect of, chiropractic care, pretty much the whole interview, which was a really unique perspective, I thought, that nobody else had really talked about.
Good. I have to go look for it.
Yeah, it's a good one.
Good.
So this has been a production of DC to Be Revolution, helping chiropractic students think big to live large. If you like this video, please subscribe to the channel. Leave some comments in the comment section below. Always great to hear from fans. And thanks for watching.